Good afternoon, and thanks so much for joining us for Healthline 3. I'm Jamie Ostroff, and today we are here with Dr. Noble and Dr. Baker from Regional Urology. We are going to be talking about hematuria for the next half hour. We want to encourage you to ask us what's on your mind, so if you are watching us online, just click on the Healthline 3 box halfway down the right side of your screen. Type in your question and send it to us, or you can just give us a call the old-fashioned way. That number, we're going to have it popped up right on your screen. Boop, there it is. 318-219-4569. I will be here with the doctors, and we will be taking your questions until 12:30. All right, first of all, thanks so much for joining me today.
Thanks for having us.
So we are talking about hematuria. What is that?
Your turn, Ashley.
Okay, I'll go this time. It is the medical term for blood in the urine is basically what it means. There are a couple of different types of blood in the urine. In layman terms, patients either see it grossly with their eyes and see red blood, or it can be detected microscopically on urine testing that your doctor may perform with your wellness visit or office visits.
And I imagine there are a lot of different causes.
Yeah, absolutely. Infection, stone, anatomical abnormalities like an enlarged prostate on men. Unfortunately, there's also cancer, kidney cancer, a couple different kinds of kidney cancers, bladder cancers, and a lot of times, in fact, the majority of the times, there's nothing wrong, especially with microscopic hematuria. A lot of times it's just a filtering abnormality and nothing's wrong. Unfortunately, you can't count on that, so they all need to be investigated.
So how do you go about investigating that?
Yeah, so we do a very standardized and complete workup that essentially clears the entire urinary tract, starting with the kidneys, going down the ureters and clearing the bladder and urethra and external genitals. And basically what it involves is a blood test that looks at the speed with which your kidneys are filtering urine and getting rid of waste. Urine testing that looks for cancer cells or looks for other abnormalities in terms of infection. CAT scan imaging or MRI imaging that looks at the internal organs in more detail. And then we complete it by looking inside the bladder with a very small scope. Mm-hmm. And so that's sort of the complete package for the workup for blood in the urine. Those guidelines are set in place by all of the same organizations that set guidelines in place for screening for other cancers. For us specifically, we see a lot of patients with both gross blood in the urine and microscopic blood in the urine. We do the workup in a standardized way, but it's important for people to understand, yes, most of the time we do not find dangerous things as the cause, but also the flip side of that is that a lot of the life-threatening conditions that we do take care of present very early with blood in the urine. And so it's a good way to screen and do early detection for kidney cancers or bladder cancers.
So if you do detect blood in your urine, what is the best first move?
Go see your doctor immediately. Do not ignore it. I'm always amazed when a patient comes in reporting blood in the urine, and I ask them, have you ever seen it before? And they say, several times. It's like, well, did you go see somebody? No, it went away. So, that's, you want to be evaluated. There's no second time. You need to, the first time you see blood in your urine, come on in and see us. You can go see your regular doctor, your primary care physician. They can check you out, see if there's an infection or something else going on, but ultimately they'll probably send you to us.
And it could be anything from nothing to life-threatening.
Exactly.
Yes. So is there anything you can do at home to prevent that from happening or keep your urinary tract healthy?
Absolutely. The most important thing at home, if you're a smoker, stop. That is the majority of our bladder cancers are tobacco related. Now, if you're a non-smoker and you get blood in your urine, you can still have a bladder cancer, kidney cancer, something serious. But the smokers, they really need to consider stopping it. If you're a smoker and you're concerned about cancer, today's a good day to stop.
Yeah, and that kind of leads us into something that you mentioned earlier. Depending on the patient that comes in, you might kind of take a different approach with each individual patient, even though they might be experiencing this same symptom of blood in the urine.
Well, actually, yeah, we might take a different approach, but ultimately what Dr. Baker said is there's a very standardized workup. The blood test, urine test, the Hematuria protocol CT or MRI, and ultimately looking up in there with our small flexible cystoscope. Unless there's something obvious found early, I really like to complete the whole workup on every patient. Every so often I have a man or a woman that I'm just convinced there's nothing wrong, and you look in there and there's something big wrong, and thank God you found it.
Any difference at all in an approach between a male patient and a female patient?
There are, for me, in my practice, I'm fortunate that really I see a lot of women. And there are conditions that women experience that are different than those that men experience that can be causes of blood in the urine. And one of the most common things that I see is women who experience declining estrogen levels and suffer from a genitourinary standpoint, from a genital standpoint externally, that can lead to blood in the urine. But even still, those patients ultimately need a baseline screening with our workup to make sure that there's not something more serious that's involving in their kidneys or in their bladder. The other thing, there are some mimics of blood in the urine that can be interesting. And sort of anecdotally, my husband's uncle called me one time and said, I'm having blood in my urine, and was in a complete panic. And I sort of panicked too and said, yeah, you need to see your doctor, and on and on and on. And anyway, he at times participates in radical diets. And so I called him back and I said, Uncle so-and-so, you haven't eaten beets lately, have you? And he said,
oh my goodness.
Oh yeah, I ate a massive amount of beets yesterday. And so there are some things that can mimic blood in the urine. Beets, high beet consumption is one of them. Extreme exercise can break down your muscles, and a byproduct of muscle breakdown can be very dark in color or maroon in color in the urine. That still needs medical attention, but it's not necessarily urologic in origin. So there are some things that different populations can experience that are different from the norm.
Yeah, let's talk about diet a little bit and how that might affect your urinary health.
Yeah, so I think the basics for maintenance of your urinary health involve the same basics for our overall well-being, and adequate hydration is so important. And I think all of us are guilty. I mean, there are days where it will be 3 o'clock in the afternoon and I've literally had nothing to drink except coffee. That's bad.
We've all been there.
That's bad. And so good, well-rounded diet with fruits and vegetables, and if you're a meat eater, lean meats, and aggressive hydration is very important for urinary health.
So there are many different causes that we talked about for hematuria. Let's talk about some different treatments. I'm sure they run the gambit as well.
Sure.
Again, it depends. The treatment is specific to the problem. For example, if you have a kidney stone, depending on where that is, we might want to do lithotripsy, which is using shock waves. We actually don't go inside your body with any instrumentation or anything. We use shock waves from outside, and it reduces the stone, hopefully to dust, if not sand. For stones that are perhaps inaccessible or not appropriate for the lithotripsy, we've got small scopes that can go all the way up into your kidneys, and lasers to pass through the scopes, again to bust up the stones. All kinds of, and then back to diet, certain stone formers, we evaluate them with blood and urine tests and find out that maybe there's a medicine or a dietary change that can help prevent stones. So the treatment, again, for blood in the urine is not really, blood in urine is not really one specific thing, it's many different things.
It's a symptom.
It's a symptom, and it may reflect a kidney stone, it may reflect a bladder tumor, which of course the management of that is going to be, depends on exactly how big and where it is. We've got surgical treatments, we've got amazing new medications that are becoming available that are revolutionizing cancer care as we speak.
All right, and I do understand we have a caller on the line right now. We have Daisy. Daisy, thank you for calling. All right, we hear Daisy, but it sounds like you're a little far away from the phone, maybe?
Hello.
Hi.
There we go.
We
Hi,
got you.
Daisy.
I'm Miss Davis.
Wonderful. Hi, Miss Davis.
Sorry about that.
How are you? I was looking at the program on TV, and I called to ask. I'm a diabetic, and I wanted to ask you all a question about your urine.
Yes, ma'am.
When your urine turn be dark sometime, and sometime middle way brownish, and sometime goldish, what sign is that?
A number of things can cause it, and we do see that commonly in diabetics. You can see patients that because of their fluctuating or changing blood sugar level, you can excrete things into the urine that can change the color. But if it is remotely concerning for blood in the urine, your physician certainly needs to check that and likely is monitoring it, but it does
I've never seen no blood in my urine.
Say that again, I'm sorry?
Never seen no blood in my urine.
It's just dark in color?
Yes, ma'am.
Does it respond when you increase your hydration, when you drink more fluids? Does it clear up?
Well, I'm sure it do.
Yes, ma'am. Yes, ma'am. I think that's fairly normal. It's just something that if it's not blood in the urine, you need to make sure it's not protein spilling in the urine, which can be a sign of damage to your kidneys and can change the way, the color that your urine appears.
Yes, ma'am. Well, I've got to go to LSU tomorrow, and I don't understand these doctors, some of them. I went to the doctor yesterday, and she come telling me about I've never taken a shot. I've told her my sugar stays the same, around over 200 and 3 inches danger. I said that's been ever since the doctor. That's been over 20-some years ago. I was diagnosed, and I said I eat stuff that I'm not supposed to, they say you don't eat. I said, it don't bother me. And it don't.
Yeah.
I said, I pray to God, I said, Lord, I said, maybe he cured me. I said, I'm sure he has. Because anybody eat like I eat, the stuff I eat, got diabetic. I had a sister that died with diabetes.
Yes,
but
ma'am.
I didn't know she was diabetic. Because she keep all her stuff, mostly to herself.
Yes, ma'am, we do that.
She's under me, and I'm the oldest girl. Still here by the grace of God.
Amen.
A lot of people don't understand that man up there is powerful. He is powerful. And a lot of them don't believe in him. Don't believe he's there until it's too late.
They call him the
Lord.
ultimate physician for a reason, right?
Oh, yes, ma'am, and they're supposed to be doing the right. Look here, a lot of them don't do the right thing.
That's right. Well, thank you for
They'll
calling
tell
in.
you
We
anything
appreciate
but
you.
something to get you to keep coming back. I found that out. I'm
Yeah.
old enough to know. I've seen my grandmother, my parents and stuff. And when I was born at 37, I'm 81 years old. They, a doctor, what doctor? They was the doctor. And everything just about what to get you well, it was out in the yard or somewhere, go pull it and all this and tea and all that. I said, Lord, if I'd knew I'd drunk that. Well, it's too late now. I'm 81 years old. My grandmother been gone almost 100 years. My mom been gone almost, I'll say 40. My God.
Yes, well,
But I want to know, should I see you come in and see somebody else? I've got to go back to LSU tomorrow, and I'm going to talk to Dr. Hahn. I ain't whatever his name is.
I think just ask them to write it down for you and write down a list of your questions, and they should be able to help you.
Who that?
At LSU.
Not that this doctor at LSU ain't going to do nothing. He go out the room, come back with something, and get typing on that. Ooh, and then he gonna tell me, don't go back to these doctors. They stay here at LSU, don't do.
Well, I hope you have a better experience tomorrow. I had a baby there about a year ago, and it was wonderful. So I hope you have a better experience tomorrow.
Some of them trying to help.
Yes,
some
ma'am.
Will do right.
Thank you
But
for
some
calling
of them
us. I appreciate
ain't gonna
you.
do it. I'm telling you now, ma'am.
Yes, ma'am.
all right. Thank you so much. We're going to get the topic back now to urology, specifically hematuria, blood in the urine. Thank you for your call. And we're going to talk a little bit more now about, a topic that did come up is diabetic patients. Do you have to take any different approach when they're experiencing that symptom?
Yeah, couple things. Dr. Baker mentioned protein in the urine. So diabetics are a very special case for blood in the urine because diabetes will attack the kidneys, and they'll get a condition called diabetic glomerulosclerosis. And it does have blood and protein in the urine. One of the things we need to determine is this all that's going on, or quite possibly does it exist with something else? When we do our CAT scan, looking at the causes perhaps of blood, for example, masses, we might give the patient dye in their veins. Sometimes the diabetics don't do well with that, so we need to assess that. But the diabetic glomerulosclerosis is handled by a different kind of doctor called a nephrologist, but it's as important and as dangerous as anything we take care of, and certainly needs to be investigated and treated.
The dangers of having protein in the urine, could you expand on that a little bit more?
Well, protein is a sign or symptom of the damage to the kidneys, the glomeruli, that the diabetes is doing. People that have excessive protein in the urine may suffer from swelling, edema, but when you're putting protein out, it's a very good sign that there may be something going on internal to the kidney in the health on a cellular level. A lot of different conditions that attack the kidneys will present as protein in the urine. And diabetes is one of them, and diabetes will be associated with blood as well.
Okay. And that's where we take a sort of team approach in terms of working that up, because we basically clear the internal plumbing system, essentially, and work up the blood in the urine. And you often see blood in the urine and protein in the urine at the same time. And then our nephrology colleagues work up the medical portion of the kidneys to make sure that there's not medical illnesses such as diabetes or various nephropathies, things that could lead to chronic kidney disease or even kidney failure. So it's nice to take a team approach with them to try to solve and diagnose the problems leading to both of those issues.
Okay, and I wanted to talk about another cause of blood in the urine, and that would be infection. Yeah. Those things, when caught early enough, can be quite easy to treat.
Yeah, absolutely. And a lot of the times we do find infection as the source of blood in the urine. And a lot of the times that's the only cause of blood in the urine. But I also, on a weekly or daily basis, see men and women who ultimately come to see me for blood in the urine, and I've had intermittent problems with it for a long time, and we're told it's just an infection, take these antibiotics, and it clears. It's important that you have the complete workup, because you can have an infection but still have a kidney tumor. You can have a bladder tumor and also get a urinary tract infection that makes the bladder tumor bleed. And so even though infection is often a fairly straightforward explanation for blood in the urine, those patients still are justified in having the full workup to make sure that there's not associated things with the infection as well.
Because so many things can cause an infection in that part of your body.
Correct, yeah.
And there was another thing you mentioned earlier of just, forgive me for not being able to put the medical jargon together, but just on a cellular level, there's just a little bit of a filtration problem, and that is totally safe, you know, and not harmful to the patient. But is there any way that you would need to or do address that medically?
So I mentioned the word you're thinking of is benign essential hematuria.
Thank you.
There you go. That's a mouthful. Right. So if you're creating urine, your kidneys are filtering your blood and sending out the things that they want to send out. A few red cells sneak past the filter. That'll show up on our tests, and it may not mean anything. If you see that and there's protein, then okay, all bets are off. That may be serious. But after we've completely evaluated the patient and there's nothing there, we see them years later, they still have a small amount of blood in their urine. There's nothing wrong. And a low level of microscopic hematuria can be acceptable. But I caution, we need to investigate that and make sure. We don't want to assume that it's nothing without investigating and proving it's nothing.
Right.
And there still are guidelines that we follow for those patients. So those patients don't just disappear and not ever receive a workup again. There's concern that if you have benign hematuria, that you still may be at increased risk of developing a kidney cancer or a bladder cancer or kidney stones compared to the general public. And so the protocol for follow-up is that you see your physician once a year for urinary examination. And at 5 years from the last time that you had a workup, depending on your age and overall health status, we talk with the patients and decide about the risks and benefits of repeating that workup to make sure that nothing has developed in the interim since they last were assessed. So it's interesting because I tell people all the time, right now our workup is imaging, bladder scope, blood work. But we have rapidly developed and are developing in the clinical trial setting urinary tests that are very sensitive for detecting cancer cells. And so I suspect that if you asked me in 10 years, maybe even 5 years, would our conversation be the same about the workup for blood in the urine? And I think no way. I mean, I think we will have sophisticated blood testing and urinary testing that spares patients from having to have their bladder scoped. And we should probably talk about that too, because we make it sound really scary. And in reality, having a cystoscopy, while not pleasant, is not extremely painful. And it's done under local anesthesia in the office. You can eat, you can drink, you can take all your regular medicines. There's no preparation for it. It takes about 30 seconds. It typically does not cause sharp pain. And so it's something that can pretty easily be done as part of that workup.
And that was another thing, I think actually you and I talked about it a little bit the last time you were here with us for Healthline, and that is just the amount of innovation and advances just in the past decade or so in the field of urology overall.
Yeah.
Let's talk about that for a minute.
Things are changing rapidly and it's accelerating. Dr. Baker was mentioning in the future we'll have urine, we already have some urine tests, but we're looking at the DNA of strands of DNA, stray cells in the urine, and we're more and more able to assess whether a patient's, we should be worried about bladder cancer, prostate cancer even. We're getting urine tests to check for that, and they're getting better. All the time, more reliable. There's sensitivity and specificity. Sensitivity is if you do a test, is it going to catch my cancer? If I have a cancer, is it going to catch it? How sensitive is it? And that's getting better and better. And then specificity, if it says there's something wrong, is it right? You know, is there really something wrong? And you know, and those two values are getting better all the time. Our tests are, we still need to do the cystoscopy, and again, it's not a big deal. Of course, the doctor would think so, but the patients agree also. But hopefully in the future, we'll have urine and blood tests, and we'll be doing fewer and fewer invasive things or unpleasant things.
Well, and that too leads into some of the advancements that we've made in terms of cancer treatment. And I'm relatively young in my practice, and fortunately have trained in a time where we have seen rapid innovation and discovery, rapid FDA approval of drugs for advanced cancers, and specifically the cancers that we predominantly take care of, which are prostate, bladder, kidney. We are seeing patients live a very long time, even with aggressive cancers. And a lot of the newer medications that have been discovered and are being given for that specific indication, which sometimes is found just by working up blood in the urine, is really given us a hopeful outlook for where we hope to see things go in the future as far as cancer cures.
So we're not only able to diagnose and treat some serious illnesses much better than we were in the past, but we're also, from what I understand, understanding how the urinary system works and just ties in with our overall health.
Absolutely.
Yeah, there were some, I remember we were talking about some misunderstandings before with certain things that, you know, we know better now. All right, so I am told we have 5 minutes left. If anybody wants to get a quick question in for the doctors now, the number 318-219-4569. Meanwhile, any other words of wisdom for patients who might be unsure of something, that they see in their urine?
Yeah, I mean, just come in and get evaluated.
Let us check you out.
I would much rather evaluate somebody and find nothing bad as a cause, or even just reassure somebody about a concern that they have, than have somebody stay home and ignore a potentially very serious problem.
And you work with most insurance, if not all? Just about all of them.
Pretty much.
Yeah.
How can someone get in touch with you guys?
So you can call us at 683-0411. You can check us out on the internet at regionalurology.com. And we have some patient-friendly information about blood in the urine and other urologic conditions that we evaluate on a regular basis.
And I know that regional urology is a very big practice. There are lots of doctors with different specialties. What are your guys' specialties?
I'm one of the generalists. I'm one of the old guys. I take care of kidney stones, men with enlarged prostates. I also help take care of ladies, but as I have ladies that on board now, I see fewer ladies, and my ladies take care of ladies.
I just boss Dr. Noble around.
She's
Fantastic.
good.
No, we do general urology. I take care of very large kidney stones that require surgery through the flank, and then I predominantly take care of women and healthcare concerns that arise for predominantly women.
All right, and we do have one more caller on the line who just has a couple of minutes to ask a question. Milton, we'd love to hear from you. Thanks for calling.
Yes, hello?
Hi.
Hey, Milton.
Hello.
Yes, I'd like to ask about prostate. I suffer from prostate cancer, and I know how can it be treated after it has left the prostate?
Prostate cancer treatment depends on the cancer and the patient. We've got everything from do nothing. A lot of cancers, some would argue the majority of the cancers, really don't need anything done.
But he's asking about outside the prostate.
Outside the prostate. Sorry, I didn't pick up on that. Yeah, if it's spread outside the prostate, the first treatment we give you is to reduce your testosterone to as close to zero as we can get it. The prostate's a sexually determined gland. It needs, at least initially, it needs testosterone to live. We can take a fellow almost on his deathbed and lower his testosterone down to zero and buy him 3 to 5 years of life. But after a couple years, 3 to 5 years, that doesn't work as well, and we've got additional medications depending on if it's spread to the bone or where it's gone. Again,
It went to one of my ribs in a small amount.
Went to a rib. Well, we might irradiate that rib. And again, we've got the testosterone lowering medication. We've got other medications. There's just a lot of choices. We've got medications that use your immune system to fight the cancer. But your doctor should be going through these with you and helping you decide what is best for you.
The medication they give me now, I take 4 pills at one time. They'd have me screaming dizzy and sweating. And then I
Dizzy and
take
swelling?
a shot in the stomach every 6 months.
Yeah, the shot's going to give you hot flashes, and the pills.
I mean, they give me so hot sweats I'm about to fall out.
I know.
You know, when I'm going to tell a fellow that we're going to put him on that medicine, and they ask about the side effects, and I say hot flashes, a lot of guys are dismissive. They go, "Oh, really? Is that all?" And they don't say that when they come back. Those hot flashes are tough.
Yeah. Well, cancer is a difficult battle, and Milton, we wish you the absolute best. Thank you for calling. All right, we've got about 30 seconds left, so just give everybody one more chance to hear your phone number and get in touch with you if they have any concerns.
683-0411, Regional Urology, and we're on the web at regionalurology.com, and we'd love to see you.
All right, very good. Dr. Noble, Dr. Baker, thank you so much.
Thank you.
Have a great day, everyone.